Hi, this is Dr. Toby, your host on health and wellness, inviting you to watch our show coming up this week with Dr. Praise Matamavi. Dr. Praise Matamavi is a transplant surgeon at the University of Mississippi Medical Center who trained at the University of Nebraska in transplant medicine, transplant surgery, and went on from there to do work at the University of Mississippi. And she's also worked at the Queens Hospital in New York for her residency in general surgery. She has an incredible story. She transitioned from Zimbabwe to work in Michigan as a doctor, and she moved from Michigan to New York, from New York to Nebraska, now from Nebraska to Mississippi. But that's not the end of the story. She's had two failed marriages, and she wants to share her heart with divorcees and teenage mothers. Coming from Africa, daughter of a pastor, having a child at 18, but still pursuing her dreams. And today, at the age of 39, she's a transplant surgeon. What an awesome story, but it's all by grace and determination. You don't want to miss it. Look forward to seeing you. God bless you. Jesus is Lord. Thanks, Ryan, for sitting. Hi, this is Dr. Toby, your host on Health and Wellness. Thank you for joining us. What a great time we've had with Dr. Praise Matamavi, this great daughter of Zimbabwe, probably the first female transplant surgeon from her country, moved here at the age of 14 after reading a book at the age of 8 about gifted hands by Ben Carson, went to medical school at the Mississippi, in Michigan State, and then pursued her medical school at Mississippi Osteopathic College, and then went on to do her residency in general surgery in Queens, New York, and then transplant surgery at the University of Nebraska, with emphasis, I believe, in abdominal organs. So I wanted to talk to you a little bit about transplant, because many of us, including myself, are not aware of the dimension. So in transplant, there's different concentrations.
There is. So there is the medical branch of transplant and the surgical branch of transplant.
Right.
So, for instance, there are kidney doctors who are regular nephrologists, and then there are doctors who do a little more training to get training to become transplant
Like an extra year.
an
Right.
extra year to do transplant nephrology.
Right.
So they take care of the transplant patients. So
Right.
that's like the medical branch of a kidney transplant surgeon. And so for heart
Same
and
thing
lungs,
with hepatologists.
right, with
Somebody
hepatologists,
becomes, okay.
right, and then like for the heart and lungs, you can have a cardiothoracic surgeon who does extra training to become a heart transplant surgeon or lung transplant surgeon. And with us, our track is you do general surgery first, and then you do 2 years training in transplant surgery. And so that encompasses organs of the abdomen, the liver, the pancreas, kidneys, small bowel, and yeah. And you're truly a general surgeon who does
Who
transplants.
does transplant?
Yeah.
Interesting. You think urologists will do transplant?
They do. So
in some places.
in some places, urologists do kidney transplants.
That's what I meant by that. Okay.
Yeah.
But
Yeah.
it's not. They don't. Do they have to do a transplant fellowship?
They do.
Okay.
The transplant fellowship is a little bit different because it's mostly most concentrated on
On the
kidneys.
kidney.
But yes,
You know, in England, that's how they do it more.
so it's the
urologists. So if you go to England and you say I'm a transplant surgeon, they're gonna be like, are you a urologist? I'm sure they have it, but it's more. You hear of the urologists doing a lot more of the transplant
Yeah.
surgeons of the kidneys than
Yes.
just the general
Yes,
abdominal.
yes.
Interesting. Wow. So you moved in there. There was a comment you made in your book about being told by one of your surgeons that the OR is not for females. Is that true?
Yeah, so in my training, because people all often ask me, how did you experience racism in New York when you were going through your general surgery training? And I always say, for me, I was the only black resident in my program from when I was an intern up until I graduated as a chief. We had a couple of preliminary residents come for their first year before they went on to something else. But for general surgery, for our program, I was the only one the whole time I was there. And so, but even through all that, I never experienced racism, you know, in that way,
That way, right.
but I experienced a lot of sexism.
Okay.
And in the beginning, we didn't have that many female residents in our surgical program, but as time went on, things got better, and more women were actually more women joined the program, which was very helpful because there was a time in our program where there were only 4 general surgery residents who were female.
Oh.
Yeah, out of
How many
30,
in a year?
31.
Oh wow, like 10 a like
Because there's
6
5,
a year.
yeah,
Okay.
there's about 5
5
a year.
Wow.
And then there's extra prelim sports. So,
I know how it. I've been in that area, and I know at times the sexist comments can be not
Yeah.
very nice. Yeah.
I have to say New York, training in New York is quite different because, you know, I had been in Michigan and then moved to New York where things were quite different. Because in Michigan, I had attendings who were female. One of our trauma surgeons was a female. One of our other general surgeons was female. So for me, it was just, there was nothing different. And then when I was in New York, we had breast surgeons and plastic surgeons who were female, but we didn't have female surgeons in any other department. So, yeah. So it's nice to be at UMMC where there is a lot of
Are there
female
a lot?
surgeons. Yeah. I actually think probably we have the most in terms of black female surgeons. I would like to say, somebody can call me and let me know if I'm wrong, but I would like to say we have the most in the country.
Really? Okay, I'm impressed by that. I didn't know we had that many.
Yeah.
I mean, you know, I know Dr. Jackson, Dr. Iwuchukwu, a few others, but I didn't know we had that many. But
Oh,
that's
yeah.
good to know. Wow.
Yeah, we do.
Wow. Now, tell us a bit about, for those my patients, so when you go in as a transplant surgeon, you're basically harvesting organs or you're putting them back into the person who needs them. Do you do that for adults and children, or are you specialized between one or the other?
So I trained in both because one thing about University of Nebraska transplant program is very well rounded, and you get to train in everything abdominal, and that's the training that I wanted because I wanted to be able to tailor my life depending on everything else that would be going on in my life to decide how I wanted my career to be. So it was grueling training because you train in both adults and pediatrics, and you're also training in hepatobiliary surgery. And also we had one of the busiest IRP programs, which is intestinal rehab. So you get to the experience is just phenomenal. If you're not afraid of a little hard work,
Okay.
that's one of the
But
best
it's like
places
10
to train.
hours from here, right? Nebraska?
Yeah, it's about 14 hours.
14
Yeah,
hours, okay.
13, 14 hours.
Because I have patients who go to Nebraska for follow-up on
Yes.
transplant. I'm
Yes.
like, isn't that a long drive? I guess it's
Oh,
one
it's
of the
worth
best
it.
places. To,
It is, and it's totally worth it.
Okay.
I am so grateful that I got to train there, and it's just it's one of those experiences where one day I actually texted one of my mentors and I said, all those days when I used to have to put in central lines in the smallest patients have come in handy. Because one day I was putting in a central line and I was like, wow, you know, at that time you're thinking, oh my gosh, how many lines am I going to put? How is this going to help me in my career?
Right.
And then one day you need to put a central line in a very difficult patient that's very small, and you say, this is why God made me
Do that.
do all those things. So everything always ends up working out for your good.
Amazing.
Yeah.
Now, you told the story in a book I read, or some comments, that you once had a patient who didn't do well in your fellowship, and you literally almost shut down after that.
Yeah.
So you want to tell us, because people think, oh, she's a surgeon, she's making money, she's glitz and glamour, life is, but we all have our pressure points,
Oh,
our
definitely.
ups and downs. I mean, people may have even died in your
Yes.
hands, right?
Yeah. And
I
that's,
mean,
you know, I think that's the part of our profession that people don't realize, and just how much we carry that with us, because we are human beings. We are not God. God is the only one who can who can handle everything. That's why we have to go to God to help us handle all the pressures and all the things that we have to that we go through and experience. But for me, I say that I'm not afraid of death because as a transplant surgeon, I see death so much more than any other profession. But also, I do respect death because I have seen what death does to families, not so much as just the individual themselves, because the individual is dead, but to their families and to their communities. And this particular experience was very difficult because
Was it a child or?
it was an adult.
Oh.
Yeah, and the patient died on the operating room table. It was a very, very complicated case, a very difficult case. But, you know, for when you get to the points where you see that medicine, surgery has limits,
Right.
it's very humbling because you can do everything that you know how, everything that you can, and the outcome still not be good.
That'd be good.
And you know, it's one of those things where it's just very humbling. And for me, it actually shows me the power of God, and it shows me that we all have our allocated time in this world. Like I always tell my kids, you have your birth date, and then you have your death date.
Okay.
You don't know when that death date is going to be, but in between you have this dash, right? And so what have you done with that dash? What has happened in that dash? It better be that you used up
Something
all your talents
beautiful.
that you were given, rather
Right.
than being afraid and just
Wow.
kind of lived, you know? We don't have the luxury to just kind of live. We are given talents that we are supposed to use. And so as hard as that experience was, I had to take some time to reflect and to think before I went back to work,
Right.
because it broke me.
Shook you, right.
Yeah, it really did.
I mean, you knew the family and. all
Because
that.
you get to know your
You get to know
patients,
the
you get to
patient,
know
yeah.
their families, you get to know, you know, what they do, what their hopes and dreams are.
Right.
Because, you know, people always assume that surgeons are cold-hearted,
Right.
and that we just come, we cut, we do our job, and we go home. No, that's not how it is, you know.
Right.
We get to know our patients. We are human beings, and we are made to have relationships. And so we get to know our patients and their families, and we
Right.
get to know them on a personal level, because they're trusting you with their life. But there are some things obviously that are beyond your control.
That's right.
So it's not all roses all the time.
And another occasion that hurt you, I'm sure, was the passing of your mom.
Yeah.
And I'm sure it still hurts till today. I lost my dad a few weeks ago, and it's been, you know, painful to say the least. But talk to our viewers about breast cancer and how your mom suffered with that and how it has affected you and inspired you to, you know, encourage women to go for their breast cancer screening. And I guess you're an advocate for, is it for breast cancer or for the screening or?
For everything.
Of everything.
breast
Okay.
cancer related.
Okay, you're like, just count me in, whatever.
So I think the biggest thing is that us as women, we have to learn to take care of ourselves. The problem is that we are so good at taking care of other people that we end up neglecting ourselves. So all the screening that we need to get done, the mammograms, we just need to do it. Because what ends up happening is that a lot of times our women, by the time they're discovered to have cancer, it's already far spread and far gone. And by the time my mom's cancer was discovered, she already had stage 4 cancer. So from the time when she was diagnosed to the time she died was a span of 3 weeks. So, you know, we didn't really have time to prepare.
She obviously didn't want to tell you.
Yes. She did not want to tell us. And you know, sometimes what happens with triple negative breast cancer is that it can be very aggressive. And it affects us African American women, you know, at a disproportionately higher rate. And sometimes women have mammograms that are normal.
Oh,
And
okay.
then when they go back for their, even before the year is over, they're discovered to have breast cancer, because with inflammatory breast cancer, sometimes it doesn't show up on mammogram.
Mammogram.
So, you know, breast exams, if something is different, if something is wrong, we just need to be vigilant and to be, you know, to really just take care of ourselves.
So you wear the pink, what do you call them, clubs? Is that what they call it?
Yeah,
Shoes.
my Dansko shoes.
To help remind you and other women to
Yes.
do what they need to do
To do
about
what you
breast
need to
cancer.
do about breast cancer, because when discovered early, it's very treatable.
95%,
Right.
no problem.
But the problem is that a lot of times it's discovered in its later stages when it's too late.
And it's all, unfortunately, it's higher. If you look at the demographics, it's like 10 times higher mortality in African American women.
Absolutely.
10 times. It's ridiculous. That in
Absolutely.
2020, we have a cancer that is 10 times higher in one race than the other.
Absolutely.
You know,
Yeah.
even though it's now the second, I think lung cancer is now number one, but in African Americans, we're still seeing that disproportionate increase.
Yeah.
So sorry about that. That must have been a
It was
tough.
very difficult. I think the
Yeah.
most difficult part of it was that she died 2 months before I graduated general surgery residency. So this is my number one supporter who
Praying
had
for
been
you.
through everything with me, my prayer warrior who used to pray for me every single day. Every morning should say, before you go to the operating room, I will be praying for you.
She'll text you.
She would text me and
Wow.
she would be praying for me. And I just had that confidence knowing that I had somebody constantly praying for me, that I was covered in prayer.
Was she a preacher too? Or was
So
she a
she
nurse,
was
or-
she ended up doing nursing actually after we came to the States,
okay.
but she was a prayer warrior.
Oh, wow.
Yeah, a lot of people would go to her for prayer. So and that was her ministry.
Praise God.
Yeah.
Wow. She was in her 50s.
She had just turned 60.
Oh, wow.
Yeah.
Wow. Yeah. A lot of my viewers, they don't understand when you say triple negative, and so break it down to them. What should they do on an annual basis to avoid breast cancer? If you can, since you're an advocate, this is a platform for you to
Yes.
tell them. Yeah.
So women who are 40 years and older, you need to go get your mammogram. Starting at 40, go get your mammogram. For women that have high risk for breast cancer, whether it's their first degree relative like a parent who's had breast cancer, or if you do know about the BRCA gene and you are high risk for that, then your screening has to be done sooner than 40 years. So the biggest thing, you need to go to your primary care doctor and you have to discuss when you need to start getting your screening, because the sooner it's caught, the better. Unfortunately, breast cancer affects us even at this age, before you hit 40. And so if you're doing self-breast exams every month and you notice that something is different, you need to have it checked out. Sometimes people think that it's just going to go away, or that it's just inflammation from something else, but it doesn't go away. So the important thing is to do your own exams at home, and also to discuss with your primary care doctor and see when you need to start getting screening.
And as a primary care physician, I can tell you some habits that do not help prevent breast cancer. Obviously, obesity is an increased risk for breast cancer. Smoking,
Yes.
cigarettes. In America now, when you say smoking, you have to spell out what they should not smoke. So smoking cigarettes, smoking cigars, smoking nicotine products, because people smoke all kinds of stuff, it's not going to help you. It's going to worsen the risk of a breast cancer recurrence. And there's so many theories about different foods. I won't bother you with that, but stay healthy, exercise, eat right, and avoid contamination of your environment.
Yes.
Yeah.
And
like Dr. Matamavi said, if you have a family member who has a history, you may need to be more proactive and do a breast mammogram earlier
than
because
40.
of their risk,
Yeah.
So let's go back to the beginning. How was growing up in Zimbabwe like? What are your fondest memories? Let me put that on a. What are your fondest memories of growing up in Zimbabwe?
So
Harare, right?
in Harare, yeah.
Okay.
So
There's another town called
Bulawayo.
Bulawayo, right?
That's
okay.
the second largest city, is
Okay,
Bulawayo.
okay.
So I grew up in the outskirts of Harare,
Okay.
and initially we lived in the high-density suburbs, and then we moved on up a little bit. So we're now living in the low-density suburbs. But my fondest memories were actually in the high-density suburbs, because just the spirit of fellowship and just the togetherness, and just being outside playing with other kids. I was just telling my husband the other day, I was like, well, yesterday, I was saying, I don't know why I'm so obsessed with peaches. Like, I eat peaches every
Oh,
day.
okay.
But then I remembered that we actually had a peach tree growing up.
In your
And I used to,
backyard.
in season, I used to eat peaches every day.
Oh, wow.
Just go outside, get a peach, and eat. So maybe that's where my peach obsession came
Ruston,
from.
next door, is actually the capital of peaches.
Oh,
And
really?
the city next to West Monroe.
Yeah.
They do a peach festival every year.
Oh,
like
I'm going to have
all
to come.
kinds of all kinds of colors of peaches. So you'll love it. Yeah, you'll love it.
Wow.
Wow. So Zimbabwe, okay.
Yeah,
And
but
that was
just
in the
the
time of
togetherness.
was that after they had handed over to Mugabe, the Africans had taken over when you were growing up, obviously.
Oh, yeah. So
Right.
we got our independence in 1980.
Okay.
Yeah, we were one of the last countries in Africa to get
Mhm.
independence.
So you witnessed the transition of
No.
business to African Americans,
So,
or empowerment, basically.
so for me, I didn't witness the transition because that is what it was.
Okay.
So growing up, to me, I didn't know any different.
You didn't know appetite.
No, not at all.
Really?
So to
Okay.
me, it was just the norm.
The norm, right?
Yeah.
Oh wow.
Yeah. That's why I feel like maybe we're a little too vocal because I feel like as Zimbabwean women, we feel very empowered to be vocal because we have seen women rise in power, in leadership, in all sectors, pretty much throughout all our lives.
Wow.
Yeah, we never had that limitation that because you're a girl, then you're limited, you know. So that's been...
You talked about your dad getting a master's in divinity and your mom becoming a nurse. So did that influence you growing up? What did your dad end up after getting the master's in divinity? He became a pastor.
So
of a
my dad
local
was a
church?
pastor from
Okay.
when I was, for as long as I've known him. He's always been a pastor. He was just advancing his education while giving us an opportunity to excel and to advance in our dreams. And my mom actually ended up going to nursing school when I was in medical school.
Oh wow.
Yeah.
So did he pastor in America, your dad?
Yeah, he did pastor in Barron Springs.
Okay.
Yeah.
Okay. Is he still pastoring?
So he works as a chaplain for Loma Linda now.
Oh,
Yeah.
awesome. Awesome.
Yeah.
I've been to Loma Linda, beautiful facility.
It is beautiful.
Yeah. Ask him about Dr. Hart. That was the chancellor. I
Okay.
don't know if he's still the chancellor.
I'll
But he
ask.
sponsored us to Ethiopia for our missions.
Oh, wow.
Yeah, pretty awesome gentleman.
Wow.
Yeah. And you told me he remarried after your mom passed?
Yes, he
Okay.
did. So he's married to a wonderful woman.
He met her in Loma Linda or
He
in
met her, yes, in
Michigan?
California. They actually met
Okay.
online.
Online again?
Yes. You know, we encouraged him. We encouraged him because, you know, him and my mom were together for 46 years.
Wow.
So he was so lost after
Wait,
she
wait,
passed
wait. You
away.
can't say that in public. You know, you're trying to say your mom got married at 14, right? That's what you're trying to tell the audience, but if they do the math.
No, they didn't. They didn't marry at 14,
Okay.
but they
They
met
met
when
at
she was
14.
14.
Okay, okay.
Yes, but they were together. They knew each other. They
Oh, wow.
dated. They actually started dating when she was 18 and he was 22. And so their farms were 16 miles apart, and where my mom's parents' farm was is the town is the I guess the area where there was the only Seventh-day Adventist church there, and my dad was the only Seventh-day Adventist in his family. So he used to get up at 4 o'clock in the morning every Sabbath and walk
Wow.
for 4 or 5 hours to get to the church.
4 or 5 hours.
Yeah, because he had no other mode of transportation,
And he'll walk back
and he would walk back
the same day?
sometimes the same day. So that's how he got to meet my mom, because her family was very involved in the church, and her parents basically took him in and were grooming him and helping him,
To
and they
become
just,
the-
you know, because he was the only Adventist in his home.
Yeah.
And so one time they decided to go to his farm, and they did a weekend prayer session, like weekend church service. And my mom was a great singer. So at that time, that's when he noticed her.
Oh,
And he was
wow.
like, oh, so she can sing.
Did you get any of her vocal skills?
No,
No, not really.
I can carry a tune, okay? But I'm not that
You
blessed.
said you exercised in Central Park, so you were athletic.
Yeah,
Okay.
I was athletic. I used to run a lot
Interesting.
more.
You haven't told us anything about your sister, but from what I read,
Yeah.
your dad was told as a young man that he couldn't have children or
So,
something like that,
yes,
and he
yes.
decided to call you Praise and your daughter and your sister Grace.
No, so what happened is that my dad was sick for quite some time, and nobody could figure out what was wrong with him. There's a
Wow.
time when he was pretty much paralyzed and confined to a bed. And
Unbelievable.
so, when he was dating my mom, he got sick after he started dating my mom, and so people would discourage her from continuing on the relationship because they used to say, well, he's a grave, he's going to die soon. I mean, why would you even waste your time with this person? And she loved him, she continued dating him.
Oh, wow.
And eventually, after lots of prayer and lots of traditional medicine, because basically
That's what
Western
they
medicine
had.
could not help him,
Wow.
he lived, and he actually got better and then became healthy.
Oh,
And so
wow.
nobody ever thought that he would get married, have children, grow old. He's pushing
Pastor.
70 now.
Wow.
And so when he had his first child, he named her Faith,
That's
because
your
it was
sister.
by faith in God that he continued on, and he was able to even get married and have a child. And then when I was born, he named me Praise, because it was praise God I got a second child.
And what does Faith
So-
do?
So she is a nurse practitioner.
Really?
Yeah.
Same pathway, nursing school
Yeah,
and nurse practitioner.
yeah.
And she lives in Beverly Hills or something.
She lives in California.
I mean, is she married, children? No.
She does have two
Okay, okay.
two
okay.
teenagers.
Awesome.
Yeah.
Awesome. So your dad has company in California.
Yes, he does.
She lives close by.
Yeah.
Okay.
He's good without company. And
Oh,
he's
really?
he's got now, my new mom. So he's good. He's very well taken care of.
So, friends, we've been talking to the Dr. Praise Matamavi, transplant surgeon, University of Mississippi Medical Center, an example of an African woman with determination who pursued her American dreams. America is still the greatest country in the world, where a 14-year-old can arrive from a different country and become a transplant surgeon. It's America and America and America that can make that happen. And
Yes.
as an immigrant, I'm happy. I celebrate this country because America has given me an opportunity to do things that otherwise I may not have been able to do
Absolutely.
in Nigeria. So we love America. We want America to be the best and the greatest and to show the light to the rest of the world. And we're grateful that people like Praise Matamavi has been an inspiration for those of us listening. Love you. See you next time. God bless you. Jesus is Lord. Amen.